great to see so much energy still left in this group. I was saying that yesterday was a long day, but I felt not tired, but actually exhilarated because of the great conversation we had and how all of us are really committed towards improving the health. I guess I have to speak loud. Of North Carolina and of the nation. I thought I'll begin just to recall one slide, which Mike McGinnis actually talked about, but I didn't. That is, what is vital directions, and how I thought everything about this meeting is re-looking at these important priorities. So as you can see, this was an initiative we did in 2016. Mark McClellan and I co-chaired this with an outstanding steering group and 150 experts that put together 19 papers on different topics of health, which are really written in a way for policymakers. And as I told you yesterday, it's been extraordinarily useful in so many different ways, including the conversation during the repeal. But importantly, what we want to do is to look at this issue, this vital directions and how it's playing at the state. And it's been very clear to you, if you listened to carefully yesterday's conversation, that action really happens right here. And I think you can be in Washington and think about directions you want to go, is until people really take this on, embrace it, and implement it when things really happen. And I want to give North Carolina a lot of credit. Of these areas, as you can see, there are 4 priorities. And actually, if you think about the topics we touched on yesterday and today, we're looking at each one of those. Pay for value, a big topic for today's discussion. Empowering people, and how much did we talk about that yesterday? Activate communities, and importantly, connected care. And certainly we touch on all those things. We also look at the infrastructure needs, as Mandy talked about the needs in this state. But if you look at them, it is measure what matters most. Certainly we had a whole session about the skills of the workforce for the 21st century, accelerating real-world evidence, and of course advancing science. So I would say congratulations to North Carolina. You really are right on track, if not ahead of the pack in many of these issues. And I look forward to the rest of the day in seeing where we're going to go. And so with that, I'd like to ask Mike McGinnis to come up here and run the session.
Thank you, Victor, and welcome back to all, and thanks for your attendance and leadership on the issues that we're talking about. As Victor mentioned, throughout the process of developing the vital directions from the national level, the most often repeated theme was the fundamental importance of state and local initiative and leadership. And it was really that dimension that prompted us in some ways to go back and look at cross-cutting issues that could be applicable at any level of our health system. And there's no question that, as Victor noted, North Carolina has provided fundamentally important leadership on each of these dimensions, especially the first 6, which are clearly dependent upon a state and local initiative. And we heard testament to that quite clearly all throughout yesterday with the important activities underway. And the reason that we heard that testament, I think, was not only because of the great activity here in North Carolina, but because of the very skillful work of the planning committee that Victor and Secretary Cohen co-chaired in putting together the agenda. With a finger closely on the pulse of the activities, the planning committee was able to bring out the extraordinary initiatives underway here. Governor Cooper, I'm just going to run quickly through a few highlights and the flow of the agenda as a reminder to those of you who are here, and as a quick update for those who weren't able to be here yesterday. Governor Cooper led off the day, emphasizing the importance of nonpartisan leadership to create and engage opportunities to decrease fragmentation and increase access to everyone in the state, to health as a goal. Secretary Cohen followed with a description of the broad health gains that were accessible with the right initiative, and emphasized the kind of strategies here that were going to make those health gains possible through alignment around common priorities, as well as through building the infrastructure necessary to engage them. We heard from an extraordinary group of participants on 5 panels that were focused on North Carolina's health and healthcare priorities. Secondly, the importance of place in health, healthcare disparities, and health equity. Thirdly, the need for integrating physical, behavioral, social endeavors to approach the issues in a whole person manner. Fourthly, the panel on connecting care through seamless information flow and data sharing. NC 360, a great example in that respect. And fifth, the importance of fundamental shifts in perspectives, incentives, and training to create the workforce necessary to carry forward the priorities. The discussion throughout the day was so rich, it's virtually impossible to capture that richness in a summary fashion, and certainly not in sound bites, but there were several sound bites that I found as I was looking through my notes, and I'll just read a few off. The governor mentioned lives of purpose and abundance as an inspiration. We heard about the importance to keep it simple, keep it real, keep it practical. We heard that there is a different way. Let's base our margins on keeping people healthy. We heard that choices depend on opportunity. And we heard the voice of Pamela Avery, shared with us by John Lumpkin. I never knew I could have a vision for the community. We heard about systemic exclusion. We heard the term segregated by design. We heard about Ward A and Ward B. We heard participants and not patients. We were reminded to be culturally humble. And we were reminded that payers play by rules, but they need to change the rules. And we also heard that we need to know what the data know. And finally, and in many ways, best capturing the reason for our conversation, we heard North Carolina has the it factor, which we all resonated with, especially those from out of town who are treated to this magnificent weather and scenery and these creative ideas. Today we'll be discussing in the following series of panels. First of all, healthcare transformation and moving to payment for value. We're going to hear about community engagement and its importance, its centrality for better health and well-being. And then we're going to end the day with a call for action, a panel that's going to review what we've heard throughout this session and identify priorities, practical, actionable steps that can be taken by all of us in the course of our movement forward.